Hi there, I'm Andrea Koppel, and it's time for coffee, the podcast where you get to hear firsthand what the jobs and careers that interest you the most are really like. Hey there, Java Junkies. How's it going? As the chief Java Junkie here at Time for Coffee, I'm obviously a lover of caffeinated beverages, but I really try to keep that in check. I would love to know how many cups of coffee you drink every day and whether you use cream, milk, or like my next guest, some ghee. Send me some snaps of you enjoying your favorite brew at Time, the number 4 Coffee LLC. And if you haven't subscribed yet, what are you waiting for? I would be so grateful if you would, and make sure to rate and review T4C as well. Thanks so much. And please grab your mug or your glass of cold brew, whatever it is you're enjoying now, because it is time for another caffeinated career conversation. And boy, are you in store for a treat today. In fact, I can tell you already that this may be an episode you're going to want to listen to a second time. That's because my next guest is that good. And what he has to share with you is that important to your health, your energy, your brain power, and your happiness. Dr. Mark Hyman is a practicing family physician and an 11-time #1 New York Times bestselling author and an internationally recognized leader, speaker, educator, and advocate in the field of functional medicine. He's also the director of the Cleveland Clinic Center for Functional Medicine and the founder and the medical director of the Ultra Wellness Center in Lenox, Massachusetts. Dr. Hyman, welcome to Time for Coffee. I don't think you're caffeinated, but are you ready to go?
I'm ready. I'm ready to go.
Awesome. Awesome. So I'd like to have you start by explaining to the Java Junkie community what functional medicine is.
Sure. Well, functional medicine, I sort of often joke, I said it's the opposite of dysfunctional medicine, which is what the rest of we have. And essentially, it's a way of thinking differently about disease. It's not a specialty or modality. It's a reimagining of our notions of health and disease based on this emerging science that teaches us that everything's connected. We, in functional medicine, ask a different set of questions. We want to know why instead of what. We have now 155,000 diagnosis codes to tell you exactly what you have. You have a migraine, but it's this kind of migraine or that kind of migraine. Or you have rheumatoid arthritis, or you have irritable bowel, or whatever the diagnosis is. Those are just labels we give to sets of symptoms that people share and tell you nothing about why you have those symptoms. So functional medicine is about understanding the why and the root cause, and then treating the cause and not the symptoms, treating the whole body as a system, not just the individual symptoms with different medications. Rather than using drugs, which are often blocking or interfering or inhibiting something in the body, we use things that help support the body. And the difference between antibiotics, for example, which kill bugs, and probiotics, which help support normal, healthy bugs in your gut. That's just one obvious example, but it's a whole system of thinking about how is the body operating as an integrated system. When you go to the doctor and you have a migraine and you have eczema and you have irritable bowel and you have sinus issues and you have some autoimmune disease, you see a bunch of different doctors for that, as opposed to saying, how are all these connected? What is the underlying cause? Is it just bad luck that you have 12 different diseases? Does it mean you need 12 different medications? Or is there something that connects all these things that will be a common thread that you can treat, and then everything goes away? That's really the approach. Mm-hmm. It's kind of the science of creating health as opposed to the science of treating disease.
And as part of that belief, you believe that food is medicine and should be treated as such. And before we get into that, can you talk about how the food that Java Junkies consume, or at least some of them consume, even as teenagers and young adults, may be making them sick? And what are the symptoms they may be experiencing right now that would be red flags for you as a physician?
Yeah, well, I think a lot of people walk around with what I call FLC syndrome. That's when you feel like crap. And that could be any number of different symptoms, from, headaches to joint pain to fatigue to insomnia to depression to eczema to irritable bowel to asthma and on and on and on. And even more serious things like autoimmune diseases or neurologic diseases or digestive issues. I mean, it's all connected. And what we are learning now is that food is the most powerful drug, and that it is not just calories, that it's information, and that information literally can upgrade or downgrade your biological software with every bite, and not over months or years, but literally within minutes or hours. And that is because, the food has not just protein, fats, carbs, fiber, but it actually has instructions like code that can change your biology. It's going to change the expression of your genes, change your hormones, change your immune system, change your microbiome, literally with every bite. So if you were putting poor quality information in your body, then you are going to get poor quality output. Junk in, junk out. And most of the food we're eating is not really food. In the last, 100 years, we've dramatically changed our food system, our food supply. And, 60%, for example, of our calories come from commodity foods subsidized by the government, including wheat, corn, and soy, which are essentially turned into flour, soybean oil, and corn syrup, high fructose corn syrup, which are then turned into a myriad of different size, shapes, colors of processed foods, which are not really health promoting. In fact, studies have shown that people who consume those foods get sick, and those who consume the most of those foods get the sickest. This is from a study published in the Journal of the American Medical Association. So there's no doubt that we're putting in the wrong information. And I think it's important for people to realize that the quality of their food matters more than the quantity. The whole calorie-focused effort to lose weight and to get healthy is just completely misguided and doesn't actually reflect the science anymore.
Dr. Hyman, the Java Junkie community are mostly 18 to 25-year-olds who, at least at this stage of their lives, are probably still able to eat what they want without really suffering some of the significant health problems that you are seeing in your practice among older people with whether it's diabetes or Crohn's or high blood pressure, things like that. But that doesn't mean that what they eat isn't still affecting their physical and mental health, right?
Absolutely. You can look fine on the outside, but really sick on the inside. So aside from promoting chronic disease later, which people go, whatever, I'm really sick or not, but it actually does affect you right now. And often people will say to me, Dr. Hyman, I didn't know I was feeling so bad until I was feeling so good. And that is really an important concept because most people just think the way they feel is normal. And it may be just a little brain fog. It may be just a little fatigue. It may be a little sleep issues. It may be, issues around a little headache, this and that, a little postnasal drip, whatever it is. People don't often connect the dots between what they're feeling and what they're eating. And the best way to do that is to change your diet for 10 days and see what happens. And I would say whether you're young or old, most people have issues, whether it's a little acne or whether it's this or that. People have issues. And of doing this for 30 years, I've rarely seen someone who's really just awesome.
Dr. Mark Hyman, thank you so much for making time for coffee with me and with the Java Junkie community today. Really appreciate you trying to educate and help these young people to hopefully live happy, healthy, successful lives.
Of course. I mean, that's what we all deserve. And I think most people don't realize how close they are to actually feeling good. I think if people have any issues with their health or any problems with their brain or whatever that doesn't leave them feeling amazing every day, then they should try to connect the dots and try the 10-day detox and see what that does.
Thanks so much for listening to Time for Coffee, where the professionals in the jobs that most interest you always have time to grab coffee 24/7, no matter where you live. I have one quick favor to ask you. Remember to rate, review, and subscribe to Time for Coffee. Thanks so much.